It's so nice to be here, Florida. It's great beaming here all the way in from the West Coast. Sounds like it's a little cold over there, but it's definitely a little bit colder out here right now. I just got my power back last night after a 4-day stint, so I was thankful. I'm like, I gotta meet with those Floridians. I gotta need my power back to do that. Otherwise, I'm going to have to find some place to do that. It's so nice to be here and to be with like-minded spirits who are passionate about healthcare justice. And I'm just really honored that Stefan, worked through One Pair of States to connect and to be able to be here and tell you an Oregon story, because there's a lot of Oregon stories when it comes to healthcare reforms. We've kind of led the way in a lot of ways on medical marijuana and deaths with dignity and the Oregon Health Plan, our Medicaid expansion program back in the day under John Kitzhaber. So there's a lot of good stories, and we're hoping to be writing another one. And at the end of this, I'll tell you how you can help us write that chapter, and maybe how it'll ripple effect right over on there in Florida. But right off the bat, Valdez Bravo, he, him, his pronouns, and deputy director at the Multnomah County Health Department. And back to my deputy role, Stefan. I got a little reprieve from the interim director business, but I'll take just 30 seconds to tell you a little bit about who I am. You heard a little bit about my bio. Oregon kid, grew up here in Salem, Oregon, which is our capital. You got Tallahassee. Salem is our Tallahassee, Salem, Oregon, and single mom and grandma. My dad's from Mexico, from Guanajuato. My mom or my grandmother's Standing Rock Sioux, and so came up very blue collar household, reliant on Indian Health Service and going to a Chemawa Indian Health Center for my care when I was little, until my mom got a job that had benefits, and I was a Kaiser kid, when Kaiser Permanente. And then again, blue collar household. I joined the Army. That was kind of my way to look for a good vocation, and I learned how to fix medical equipment of all things in the military, and that's how I stumbled into healthcare. Fast forward, 8-year enlistment in the Army, serving all around, go to Afghanistan, came home, worked at the university hospital, and then the VA. And I was at the VA for, like you said, 18 years. Started out medical equipment repair, but went back to school and got my master's in healthcare administration, MBA. And it was interesting going to get that degree, because I was at Baylor University, a very conservative school. I mean, Ken Starr was the chancellor and president, for God's sake. Very conservative school with Army instructors. But they were talking about the same thing back then. This is right after Affordable Care Act passed, 2013-ish. And about this broken system, waste and inefficiency, and how like the quarters 5 forces of markets are totally skewed when it comes to healthcare and what's going on with healthcare. And it's just really interesting, because right after I got into grad school, I got really enamored by this guy named Bernie Sanders, if you've heard of him, if you those of you that have felt the burn, and he was talking about the same thing. So I'm like, okay, so these Baylor instructors and these Army guys are talking about the same thing now. This frizzy-haired guy from Vermont's talking about, and I've just been all in on healthcare justice and reform ever since. I joined the board of Healthcare for All Oregon in 2018 after becoming very politically involved in 2016, like a lot of people did. A lot of people were already involved. A lot of you were probably already involved, but I got involved then. And Bernie said real change happens from the bottom up. So I stayed plugged in, and I picked the battle I was going to fight was going to be healthcare justice. So that's what I've been doing. And so I'm excited to tell you about Healthcare for All Oregon, this awesome organization that I've been a part of, and that I'm serving, as the pleasure and honor of serving as president. Just tell you a little bit more about who we are, what we've been up to, how we're going about doing the same things that y'all are fighting for, and how we're all kind of in this together. So with that, I'm just going to share my screen and do a little bit of visual, so you're not just being talked at the whole time. So Healthcare for All Oregon, we're about 20 years old, a little over that. We're old enough to drink, just kidding. We were founded in 2000, and so we're about 23 years old as an organization, 501c3. And our mission is we educate about and advocate for an equitable, affordable, comprehensive, high quality, publicly funded universal healthcare system. It's going to improve the lives of individuals, families, and communities across Oregon and throughout the United States. That's where y'all come in, throughout the United States. We're hoping that Oregon, if we can do it, it can be a model. It can be a best practices pointed to. It can deliver results. It can provide that precedent, like Oregon has done on so many other fronts, like I said, with medical marijuana, deaths with dignity, other radical transformations. It seemed radical at the time, and then with the passage of time, they only become more normalized. So our vision is a healthcare system that ensures comprehensive, high quality healthcare to all, full stop, right? Everybody in, nobody out. That's our motto out here. We provide care based on patients' needs rather than profits, focused on prevention, effective treatment, and improved medical outcomes, and is publicly financed, directing resources to medical care and minimizing administrative expenses and waste. And I think that sometimes I don't think we lead with that. I think we lead with the heart and the justice side of this. But I think that there is a real argument to be made with some of the folks that say, how much is this going to cost? Well, it's actually going to cost less. In fact, I'll talk about that in just a moment. You can see our website there. I encourage everyone, I won't be offended if you got two monitors or something. If you're going to hcao.org while I'm talking, I would love it actually. Check out our website. I'll go to the next slide here. So basically, this is kind of I'm not going to spend a lot of time on the problem. You all know the problem. We're talking to Medicare for All Florida. And we know that the solution is, a single payer system, better care to more people for less money, freedom from worry about your family's care, freedom from health insurance complexities. And so this is kind of just like a snapshot of who we are. We are a 501c3. Wasn't always that way. We started off as a 501c4 back in the day. And but somewhere along the way, I think probably the fundraising committee probably identified that, if we were a C3, we might be able to pull in some donations and stuff from people that are, with that tax benefit and stuff. So at that point, there was a divergence, and now we have Healthcare for All, Oregon C3. That's what I'm president of, and our awesome executive director, who's a former Floridian, Mary Beth Healy. A lot of you probably know Mary Beth. She's on this call. It's good to be here. She's the brains of the operation, by the way. So we're the C3, but then there's also Healthcare for All Oregon Action, who can endorse candidates, who can send out fundraising things with that political dynamic. And we could do a little bit of that. We got to watch it. We can only do so much. But there are two Healthcare for All Oregons. One's that political arm, but we're the education advocacy arm. And like it says advocate, educate, or engage, organize. Basically, if you had to sum up our strategic plan and like what we're all about and what we do on a daily basis, it's kind of like easy for me to boil down to four things. We advocate and educate, so with that C3 hat on, we're out there myth busting, we're debunking, we're highlighting the issue, we're saying there's a better way. Familial bankruptcy because of a family medical crisis is not normal. Doesn't have to be that way. There's another way. The rest of the world kind of does it in a different way. We're kind of an outlier. Yes, we're spending the most on money of anyone in the free world, but we're also getting some of the lowest outcomes in many regards. So we do that kind of education that I'm sure a lot of you all are doing, maybe on the individual or even organizationally. But then what we do is we also try to raise resources. Fundraising. We have a sustaining donor program where if you go to our website, and please consider it, become a member. It's like, NPR, $20 a month, right? $30 a month. We get those donations, and that's kind of, we raise resources that way. People sign up to be volunteers. They donate their time, their treasure. Some people do both. And we get those resources in, and also from our membership organizations. We're strong allies with labor. We got SEIU. The teachers, we got a big labor coalition. We're part of other justice-minded coalitions here in Oregon. So we get all these resources of the time and treasure. And then the third arm, so we're educating and engaging and creating that awareness, highlighting the problem, naming the problem, showing people there's a better way. And then we try to get people who are like, hey, yeah, I'm down. Like, put me in. I'm gonna sign up. I'm gonna get in the boat with you. So we sign them up, and then we mobilize those resources to do the aforementioned, right, to get the word out even farther, but also to advocate for good legislative policy. And that's the fourth arm, is passing good legislative policy to move this ball forward with the ultimate goal of getting towards single payer healthcare. So that's a little quick view of just kind of our website, hcao.org. I'm going to stop sharing screen here so I can talk to you guys and look you in the eyeball to eyeball here, so to speak. So a little bit about us, just about the history and what we've been up to. Like I said, we've been around for about 40 years, 20 years. And so I'm just switching screens here. So basically, we've really, in many ways, led the nation in successfully advancing healthcare reform efforts designed to cover more people and hold the healthcare industry accountable. Somebody needs to do that. However, even with that legislative progress, we still have an inefficient, expensive, and chaotic system. Recent reports from our Oregon Health Authority, which is our big statewide health agency administration, cite a 40% increase in healthcare costs over the past 10 years. And this exponential rise is really unsustainable, as you know, for families and individuals, as well as the businesses and the taxpayers in Oregon. Think about how many small businesses, this is trying to survive with these these healthcare costs. For most of our history, we have been a largely volunteer-run organization. If sometimes when you're donating to a C3, you see like the administrative costs. Ours has typically been very low. We're pretty much like a volunteer-run organization. But our tenacity and the passion for this, for advocating for the system, has really fueled our volunteers to do some really awesome, get some awesome things done, and it allowed us to achieve significant policy progress. Just over in the past decade, incredible strides have been made to broaden the healthcare coalition and expand opportunities for partnerships and legislative action. One thing we did is back in 2017, we had one of our legislative champions, Senator James I. Manning Jr., advocate for the passage of Senate Bill 770 in the state legislature, which I encourage you to look at our website at hco.org. We created the Task Force on Universal Healthcare. And what this was like a task force to go out and go all over the state to talk to technical advisory groups, communities of color, providers, everyone that's kind of in the system to say, if we had some kind of universal healthcare system, what would you want out of that? Like, how should that work? What's important to you? What should we prioritize? And so they collected like all this information, and it went on for several years of gathering this information, doing this report. And really when they published it, the recommendations in September 22, the task force asserted that Oregon could design a single payer system, which would be not only more cost effective than the dollars we spend today for health services, but it would be in a more efficient and humane manner, as you all know. And when we say a more cost effective, now some people think this is a conservative amount. Right now, we've got about 1 in 3 Oregonians dependent on like OHP and like so many people that are uninsured or underinsured in Oregon. We could bring everybody into this plan under one umbrella and save $800 million. So almost $1 billion with a capital B of savings, and having everybody in and nobody out. I mean, it's just, and that's, some people say that's a conservative approach, because like, is that fully, like if we had one formulary for the state, or, Big Pharma was, getting negotiated with the state of Oregon rather than a bunch of individual players, and just a lot of the other efficiencies we would gain from this. Pretty impressive. So that was going on. And then in 2019, right around the time that I had gotten involved as vice president at the time, our Healthcare for Oregon board created a strategic plan. And the strategic plan was designed to propel Healthcare for Oregon to even greater heights. So even with the global pandemic, we were able to advance on many of the goals identified. And like all of you were figuring out how to switch to the Zoom stuff and everything, which, was kind of a mixed blessing, right? It's like, I'd rather be in the room with y'all, but it's hard. Oregon's the 9th largest state in the union. It's kind of hard to get everyone in a room all the time. And so leveraging Zoom, we continue the process, and with our strategic planning process, we basically passed significant legislation, and we were able to hire a full-time executive director in 2023, Mary Beth Ely, on the call. So then the next thing we did, so we got this task force, right? So September 22, we got this task force. And what also happened in that same year, what we were advocating for while they were putting the final ink on that report about what Oregonians wanted and the systems wanted out of a universal healthcare system, we passed Measure 111. Now, Measure 111 is not just a cool name, but it's also the measure that made Oregon the first state in the nation to codify the right to healthcare in its constitution. We added healthcare as a human right. We're always talking about in our world that healthcare is a human right. It wasn't in our constitution, but it is now. Now, does that have teeth? Does that mean that with the swipe of that pen when that happened, that everyone immediately got healthcare? No, but two things. One, there's been a lot of great things, especially related to campaign finance reform out here in Oregon, where it passes, and then somebody appeals it to the Supreme Court, and then the Supreme Court justices scratch their chins and they say that's not constitutional, and good legislation, good progressive legislation gets undone. That won't happen now. It's in the Constitution. It says it's a human right. The other cool thing about this was that people said, wait, yes, definitely, but we should do more. We should actually create a system that does this. So sometimes, when we do this progressive legislation, we're advocating for universal healthcare. People go, I don't know. They want to talk public option. They want to talk incrementalism. We're about anything that moves the ball down the field. But the fact that we were saying we're doing this, and people were saying yes, and we also think you should do more. Like, that's a great place to be in, and it really set us up for this next battle that we fought, which was to get to advocate for Senate Bill 1089. If you go to our website, hcao.org, and I'm going to just drop it so it's super easy to just click on in the chat. Here you go, boom. Click on the legislation tab, and there'll be a snapshot of everything I'm talking about. So then what we did was, with the task force, we had these recommendations come out, and we advocated for a universal health plan governance board. Now, this is so cool, my friends. This is like it's happening. That's like happening out here in Oregon. So we had this task force. They go out for 2 or 3 years, like a Roomba. It was going to be less, but it was like, COVID kind of happened, so we kind of had to add some time. But it was like this task force was like a Roomba. They're like bumping around, absorbing all the input across the state of Oregon, urban, rural, communities of color, different faith-based organizations, systems. And they took all these pieces of what needed to be in a universal healthcare system. And they put it like, let's say, put it in a box, like a big puzzle. It's like a big Lego set. And now what we need is a group of smart folks to come along and build it and like almost like a rector set, make a working model of it. So what's happened is we got this bill passed, and they're hiring an executive director. The governor is hiring, the Department of Consumer Bureau of Community Services, and then they're going to basically have and it just got named yesterday. Actually, breaking news here, folks. There's a 9-member governance board, 5 who are medical professionals, 4 who are not medical professionals, and they are being charged to take those recommendations of the Joint Task Force on Universal Healthcare and take all those components, all the algebra, all the variables, all the factors, and put them together and build a system. So pretty soon you say, well, how much is it going to cost, and who's going to pay for it, and what's going to be covered? We're going to have a mock-up. We're going to have a draft model to react to and futz with. We'll have something, a starting point that we can point to and say, this is what a working model would look like. So that's happening right now. The ED is getting hired. The 9-member board was just named yesterday. We're super excited about that. And it's rolling forward. They've got, the goal is to get this done within 2 years. And then what would happen, my friends, is we are hoping that what will happen then is, since we have a fair number of legislative champions who are advocating, who are with us, right? And even one of our members of the board is running for office right now to be in the room, as she says, when these conversations happen. We have legislative champions. We're going to hope that those legislative champions refer it to the voters, right? A legislative referral. They're going to package it up and put it to the voters. And then we're going to need everyone's help across the nation to rally and mobilize, because the big special interests are going to come combat this. And we're gonna get the word out. And so between now and then, and that's like 2026, 2027, 2028, between now and then, we gotta inoculate the public from the myths that are gonna come and the lies and the saying, oh, it's gonna be more expensive and you're gonna have ration care and all these kind of things that are gonna come down, saying it's impossible, that it's too pie in the sky, and things we all know are not true. We're gonna inoculate the public using that education, advocacy, and awareness between now and then, between them. Now, if the legislators say, oh, I don't know, and everything, and they're halting, then we're going to do that. We have a petition backup plan where we'd like gather up a petition and do a ballot initiative to put it on the board, on the ballot that way. So 2 options. Sometimes the legislators like to do it themselves, because if you let the activists run it, they like to maintain a little bit of control. So that's what we're hoping for. That's what we're working for. We've had so much success in these past several years. But a couple things I just wanted to say. One, although we're very state focused, we, of course, are big champions of Representative Congresswoman Jayapal's Medicare for All federal bill. We're huge fans and proponents, and we encourage you to all look at and support, if you haven't already, Ro Khanna's Sambuca bill that would actually provide some, make it easier for states to do these kind of innovative solutions by like creating waivers and some funding streams. Definitely check that out. I think Chuck Pinocchio from Washington is on that. He's working on Sambuca. But it's happening. I mean, sometimes when we're just because it's a hard fight doesn't mean we're not willing to do it. But I just want to tell you folks, like, I hope, check out our website. You're out there in Florida. You might think, okay, well, that's great, Oregon. What's that have to do with me? Honestly, whether you're in Orlando, Tallahassee, Miami, Fort Myers, wherever you're at over there, if we can do it in Oregon, Washington, it's kind of funny. California's working on similar bills. They just passed an SB bill, and it was a 770, which is the same one that created our joint task force. It's like, whoa, the stars aligning here. So it's starting to feel like Twilight Zone. Washington states, they've got strong work happening. There's a lot of places having the state. But what I'm hoping is that the more we can tell this Oregon story, the folks that are kind of like far down the line, other states that, they're doing their work, but especially if there's other states where they're a little bit farther from it, maybe they take their chips and they push them over and they support us out in Oregon. Because if we can get it done, so as goes Oregon, I think hopefully we'll go the nation. And I think we're going to have a really good plan. It's going to have funding. It's going to have all the kinks worked out. It's going to be a good model. And just like we did leading the way in the past on healthcare innovation, really medical marijuana, death with dignity, the Oregon Health Plan, I think that Oregon can be the first one to get this done. And I think it'll be a model that the rest of the nation will want to follow, and including your folks that would make it easier for Representative Escamani and others to get it done out there. So anyway, that's all I got, Stefan. I hope that's helpful, and I'm happy to answer any questions that you all may have.